Senator Rosen.
Thank you, Chair Murray, Ranking Member Burr, for holding this vitally important hearing today. And I really want to thank all of the witnesses for helping to get our country vaccinated. It is so important to every person that we know and love in our community and our personal lives that we do everything we can to save them and protect them. And I appreciate your hard work in this regard. And so I just want to speak a little bit about vaccine outreach, because our country, we have made tremendous progress over the past several months in making the vaccine available to most individuals, to getting shots in arms. I've had the honor of going to some of the vaccine sites, of course, clinics in my home state of Nevada. Our healthcare heroes, they're pillars of strength in our community, showing up day after day to be sure that everybody that wants a vaccine can get one. And we just can't lose ground. But unfortunately, Nevada is, our cases are growing, and we seem to be getting to the top of a list. Nobody wants to be in the cases of the Delta variant. I'm extremely concerned about the lag in vaccination rates. In fact, last week, especially in nursing homes, Senator Cortez Masto and I sent a letter to Secretary Becerra to raise concerns about the low reported vaccination rates in Nevada nursing homes. And we have to find a solution to protect those most vulnerable who can't go out to a site and even their loved ones couldn't take them. So Dr. Walensky, are there any plans for the CDC or in coordination with other agencies to restart the pharmacy partner program that sent teams directly to every nursing home, perhaps for every facility, with less than a 90% vaccination rate for residents and staff, and I might even say families of staff who they go home to?
Thank you for that question, Senator Rosen. And we recognize this challenge, and we are with you in that. In fact, we have 10 CDC people deployed to Nevada right now, working to assist. Part of the long-term plan in terms of working to vaccinate our long-term care facilities is not necessarily these staccato partnerships with the pharmacies, but to have a longitudinal plan, because in fact, especially in our long-term care facilities, there's quite a bit of turnover of the patients, and we want to make sure that there's always vaccine available. Many of these long-term care facilities have access to pharmacies, and we want to make sure that there's a vaccine actually active in the pharmacies so that they can do vaccination when patients come in. I agree with you, and in fact, we need to work to get our staff vaccinated as well. In fact, staff in some of these long-term care facilities are, 20% less coverage than the facility members themselves, the residents themselves. So we are working on confidence in those areas, but specifically strike teams in with the long-term care facilities to assist in getting vaccine to those places. That's not reliant on a one-time, mass vaccination, but really has a longitudinal plan to make sure vaccine can be available in the long term.
Yeah, and I would hope that you'd include the families of the staff, because oftentimes they have a high turnover too. They go home to their community, and you're just going to keep putting out that fire over and over. But I'd like to switch now and talk a little bit about the research in vaccines, because obviously we're discovering more about COVID every single day, and I think for years to come we're going to continue to learn. And so now is the time to take those additional steps to see we don't look back and find gaps in data that could have been prevented. Those gaps could have been prevented if we'd acted sooner, speaking of longitudinal. And so data like this could save lives. That's why I introduced the Ensuring Understanding of COVID-19 to Protect Public Health Act. It's bipartisan legislation that requires those longitudinal studies on a variety of COVID patient populations with regular public reporting. For example, some of the recent research is showing that COVID-19 vaccine may actually improve symptoms for some patients with long-haul COVID. So, Dr. Fauci, what do we know about this so far, and how common is the vaccine to be a strong prevention tool, but also to work therapeutically in this case, and what else should we be studying?
Very good point, Senator. And there has been anecdotal reports of people who have been infected, have developed long COVID, and their symptoms have been improved upon getting the SARS-CoV-2 vaccine. That has not been proven under the scrutiny of a clinical trial. So right now we're looking at individuals who actually have recovered and seeing if in fact vaccination does improve. Right now, although the anecdotal cases suggest that, I don't think we can say anything definitively from a scientific standpoint, but that's something that's being looked at.
Thank you. I see my time is up. Thank you. Thank you.
Thank you. Senator